Hannah, I assume you've started recording at this point. So today's webinar is from the National Development Research Institute, more specifically the Center for Fire Rescue and EMS Health Research Group. And we're having a conversation about best practices in the vaccine rollout. So I'm joined today with some distinguished guests from the fire service. That includes Chief Lombardi, who's the fire chief for West Metro, Dr. Augustine, who is a physician who represents the IAFC's COVID task force, Dr. Gupta, who is the assistant medical director at LA County Fire, Captain Chet Ellis with the Unified Fire Authority in Utah, Chief Peterson with the UFA, the fire chief there, Operations Chief Dustin Dern with the UFA, and Chief Asseltine, I think I got that right, or Asseltine, who's a division chief with West Metro Fire. So thank you all for being with us today. Something we would encourage our attendees to do is to send us a message in the chat if you've got a specific question. My intent today is to carry on a conversation about a hot topic, and that is the vaccine and its rollout within our fire departments, especially with our firefighters on the front line and dealing with COVID patients all throughout the pandemic. I wanted to start off by essentially doing a little pulse check, if you will, with the various members. And I know this can be subjective, but with the folks that are here today, and we'll start with Captain Ellis, and I'll go through my screen. I'm curious, what is the rollout situation, and what percentage of the members of the firefighters have chosen to take the vaccine? Any idea?
I think probably Chief Dern and Peterson would have better numbers for Unified Fire. One of the main reasons I'm on this call is I helped organize and schedule for all of the Salt Lake County first responder agencies. So I'm currently here at one of our mass vaccination sites right now. So that's my involvement, is really coordinating the whole valley and the whole county as a whole. And I know we've got really great numbers in Salt Lake County. I don't have the specifics. Chief Peterson, Dern may be able to chime in and give those.
Yeah, Chief Peterson or Dern, what does it look like with your organization? All right, Chief Peterson, we've got a little bit of audio problems with you. Chief Dern.
Yeah, how's my audio? Is it bad as well? Good to go. Okay. Yeah, so currently we're sitting for the whole organization, we're about 73% vaccinated. And out of those 73%, about 340 of those individuals are line personnel that have been vaccinated. And then obviously other support staff and admin staff is part of that. So we've done pretty well within our organization. And it was a bit of a surprise to us if we compare those numbers to even our flu vaccination rates compared to last year. So we're way above what we typically see with that vaccine.
That's fantastic. Chief Lombardi, what do you see within your organization? Anything close to 73%?
So we did a kind of a pre survey to see just anonymous on where we thought we would be at. So we did 3 questions. Will you get the vaccine right away? Will you get the vaccine at some point? And then will you not get the vaccine? 87% of our folks said at some point or they would get the vaccine. So 13% has said not. But I'm going to hand off to Steve Asseltine. Actually, this is his bailiwick. He is deep into our numbers right now. So he can give you all of the good, and actually it's really good news comparatively. So I'll hand off to Steve.
Thanks, Chief. So for West Metro, the total organization, we're at 74% as of this morning, and we only track when they've completed their second dose or their Johnson & Johnson vaccine if it's 1 dose. The online percentage is 77%, so we're a little bit lower on the civilian side. So total 74%, and then the online uniform members are 77%.
Chief, let me just tag on there. I'm curious, how did, and those are good numbers. Those are compared to other departments I've visited with on this specific topic. Those are very impressive numbers. What would you say in terms of commentary about the rollout within your organization? What do you think is contributing to such success?
I think there's a number of factors for us, but early on, we started a campaign of communicate, educate, and vaccinate, and really wanted to be open and honest with our entire organization, and give them options, across the board. But really tried to look at vetted resources, give them the best truth, and then communicate with them consistently. So we do a COVID-19 brief basically out to the organization on a weekly basis. And within that, we're, value messages about, it's not just about you, it's about, other folks and things like that, and the service to the community and all those different things. And then ultimately creating access for vaccinations as well. So the first the first real access we had, we actually took folks on duty and got 60 people on one of our shifts right away, which helped us. And that really started kind of some of that momentum going for us as well. And then we had a few other folks that were working with public health and some other agencies that really opened up access for us, that were just made it a little bit easier. And then we incentivized it a little bit as well by paying for folks to get vaccinated on their time off once the scheduling became an issue and things like that for us. So I think utilizing a number of different strategies, but really focusing on information and education were the things that really helped us to move forward.
That's good information. Dr. Gupta, with an organization like LA County, how has the vaccine rollout been going, and what kind of success have you seen there?
It's been excellent. Our vaccination rate was about 72% to 73%. We continue to have people trickle in, and you can call that successful. I think it went quite successfully. Just to give you an idea of how that affected us as an organization, I actually was the lead medical director for the COVID surveillance and monitoring system within LA County Fire. And during the surge in December, we were regularly returning 20 to 25 back to the field, but then we'd have 30 get ill. About a week after the first vaccine, that number rapidly dropped down to about 1 to 2. So we had the vaccination worked well, and I think with the herd immunity of it, we also are having a decreased infection rate in the stations.
Dr. Augustine, what's your lens on this topic? I know that you certainly have some viewpoints from different areas of the country, and in your service on the task force with the International Association of Fire Chiefs. How do you think we're doing as an industry as a whole, and in your experience?
In the departments I'm associated with, which include both larger and smaller departments, there is a momentum. That's a really good word. And in many departments, it has been a positive momentum, and it built over the last 2 to 4 weeks, I will say. Initially, we really did a disservice to the entire industry by around November, having published some messaging that said, oh, a lot of fire members are not going to take the vaccine even when it comes out. Based on nothing but rumors and innuendo messaging that was going out about the safety and effectiveness of the vaccine. That momentum, as all of you know, carries through the fire station for a long, long time. And the the social media messaging at times became very negative before the vaccines were even released. And a lot of false information was spread. Other departments that kind of, first of all, had significant impacts by members getting very ill, they were very anxious, and the momentum, if anything, was very positive from the beginning, but those didn't get published. And so we had kind of this one-sided message that was going out. Very fortunately, a lot of people put experts, like the people that are on this panel, in front of their members and offered both active information that they delivered at the time, and then very importantly, they answered questions, and they answered them in a non-judgmental way, and were able to really get through people's fears and what they had seen on a report somewhere or on the internet. And I think in those departments, we're looking at 70 to 90% success rate in vaccinations. Where medical directors are very active and offering that same kind of information service and answering individual questions, those very high rates have also been carried. There is an organization known as the Eagles, which is the big system medical directors. We surveyed our own members, and there's about 60 physician members from across the country. Those that had the most direct impact on disseminating information were the ones that had the highest acceptance rates of the vaccination. So a little bit of information, Tom, to help people understand. If we actively get in front of the railroad train and say, the information you may be seeing doesn't have a lot of credibility, let's talk facts and let's talk experience, and let's remember the members of our departments that have gotten very ill or died. And not always does that influence everybody, but it sure has a better influence on people who are hesitant to begin with. Thank you.
No, I think that's a great segue. Certainly communication in the fire service is always detrimental when it's not facilitated, well. And so that makes sense. I appreciate you saying that. I'll open up the floor here, because I'd be curious about what other resistance there was out there and how it was overcome. I think that's a good story. Dr. Gupta, go ahead.
Myself. Thank you so much. And I completely agree with what Dr. Augustine and everyone on this panel has said. One thing I always like to convey in terms of andragogy, right? So we're all adult learners, and adults view the world in a very specific way, and that we have to tailor our messaging to that. So firefighters come at this from multiple viewpoints, but one of them is the drive for the mission, right? The drive to be firefighters, the drive to save lives. So what we did internally, what I did and my stuff is we actually we evaluated everyone who had COVID, and then we evaluated how it would affect them in their ability to do their duties. Because firefighters are a very specific breed. They're all very fit. I don't know about your departments, but I like to say even the chubby firefighters are a layer of fat on top of a whole lot of muscle. And so I analyzed our department, and we found that about 40% or 39.1% were significantly affected and unable to do their duties effectively and safely for over 2 weeks. So that when we told firefighters, this is going to be your impact to the job, you're unable to do your job, so people are going to be pulled back into your field, and even when you go back, this may be risky for you. That made it much more real to them in terms of the virus itself. And then, of course, what Dr. Augustine said in terms of being as transparent as possible about the data and the black holes in our data and what the projections were. Thank you.
That's great. Other comments or experiences about resistance you had within the department and how you overcame it, Chief?
So we looked at this because we were giving a lot of COVID type leaves above and beyond what our collective bargaining agreement had called out for, even for our civilian staff, which is the right thing to do for us. And we found that the vast majority, in fact, I don't think hardly any, if any, Steve, that we had any, if you will, on-the-job exposures, or we could put it to an on-the-job exposures. But we were having exposures or people getting COVID and such. And so we looked at this really hard to say, okay, when the vaccines come out, are we going to make them a requirement to get a vaccine? Now, I know that there's a lot of different legal opinions on the fact if we could do that or not. Our attorneys and our labor attorneys actually looked into this and said, yeah, you can, at least for us that we could. So I vacillated really hard. In fact, Steve was instrumental in helping me with the decision-making process of, do I mandate it or do I not? And certainly we could have required it for all the right reasons to say, you know, from a public health standpoint, from a that we want to make sure everybody's safe, your families, all of those things. But in the long run, after talking to a few of our folks and talking to our, you know, our senior leadership within our organization with all of our chiefs, I felt like that wasn't the right thing to do. The right thing for us to do was to strongly recommend it. But then in turn, like Steve said, is to give them factual information and to ask them to look and educate themselves by what we're giving them, but also go out on their own and finding validated data type decisions or research that's been done on this, so that they can look at this and not think that, you know, that you're not getting injected with a chip so that people know where you're, you know, where you're traveling to and things like this. And I say that a little bit in tongue in cheek, but I've actually had people tell me that's what's happening. So where I've had people in our organization on one end of the spectrum thinking that I should build them a bubble to respond within. And then I've got people over here that think that this is so made up they can't even see straight. So we're trying to fall somewhere in between, but we've worked really hard to ensure that the data that they have is consistent. And that, like Steve had talked about, that goes back to this communication. We painstakingly took a lot of effort with our chiefs to have the same message, and then with our local to have the same message. And actually the local has been part of all of our COVID response and meetings as well to help facilitate that message. But then in turn, then anything that was not factual, we were able to then discount that quickly and give them information that was correct. So just being up on top of that really helped out. But, you know, we really vacillated on mandating it or not mandating it. And that's where the pushback, I think, has been less, because we told them, I actually got in front of the organization and said, I know I can do this. I'm not going to do it, and this is why. So I think that in turn took away some of their angst on that part of it. So that really, I think, helped out on that.
That's a great story. I appreciate that, Chief Lombardi. Other comments on resistance? How about in the UFA? What did United Fire Authority? What's been your experience there?
Let me see if my mic is working now. Is that a little bit better? Yeah, that's good. I think that, like Chief Dern said, we're seeing a 73% now, but we're seeing it creep up as we go along, and most of that is scheduling problems, right? Bottom line for us, I think that there was all of the anti-vaxxer or other issues that were prevalent here in Utah, but I think our ability to move through that started a few years ago by just rebuilding trust and being open and honest, right? And like what Don said, and Steve and others, we did form an IMT. We actually moved people onto days, including the union president, and covered his time to be a part of that and just deliver that information positively and addressed it at their level, the concerns they were having. But I think if the vaccines had rolled out a few months earlier, we would have had a lot more pushback than we did when they did roll out, because by the time they rolled out, we had enough people. I think we ended up 86 positive out of our 600 and some people, 450, 500 career staff. We had enough people that had some bad experiences that after a few podcasts with the people that were recovered, and they expressed the fact that they may be back to work, but they're still not 100%, and talking about the struggle they're having. And even now, we had a couple of recruits that were COVID positive before, totally healed and ready to go, but had to drop out of camp because of additional problems, probably related to COVID, and they'll need to recover and come back next year for camp. Those stories, I think, slowly shifted people to the right thing, and being straight up and honest, like Don said, giving COVID leave, being honest about it. We spent quite a bit more money covering those positions. But in the middle of that, we had to implement a mandatory staffing just to maintain staffing levels, which compromised, everybody's but the story was still there. So getting the vaccine allowed us to eliminate COVID leave, reduce mandatory staffing, and get us back to normal and maybe remove the masks in the stations. Bottom line though, it was trust, having people at their level being a part of the story, telling the story at all levels, and requiring a declination if they decided not to do it was a very valuable. They have to actively say they don't want the shot. And then our medical director reaches out and talks to them about it, tries to clarify on a more one-on-one or 1-on-15 type level. Nothing real different. I think it was the whole package of it. And without the trust, we wouldn't have got anywhere.
I can't help but wonder in the fire service, typically it's a lot of similarities amongst departments, no matter their size or complexity, geography. And so, I'm hearing some reoccurring themes that certainly resonate with me. Things like trust when we're talking about the vaccine. Even, I know it was intended to be a little tongue-in-cheek, but Chief Lombardi's spot on with conspiracy theories about microchips and some concern about the rapidity of development of the vaccine. What other concerns did you all hear from the women and men within your organization when it came time to roll out the vaccine? What else was there? Yeah, Dr. Augustine.
Yeah, I want to say to your point and to the point of the other chiefs, credibility and trust was built throughout the past year, and someone who wasn't as in touch with their department, wasn't as honest and frank, even at times when we didn't have very clear information. But the chiefs built trust throughout this. And then when it came time to make recommendations, they had built the credibility with their staff. That's really important. Number two, we have a reputation within Fire EMS of protecting our people very well. I always begin all of my education with, who's worried about getting hepatitis B today? As you sit in the room with me, who's worried about getting polio today? In the room with me, you all, we started your journey here in this country and in this department by protecting you from everything that we could. None of you are sitting here today worried about polio because I was the last generation that got polio shots, and very quickly we went to orals, and very quickly everybody in the population is immunized. A terrible, dreadful disease. I have been in the service long enough. Hepatitis B was a big concern and a big threat. And very quickly we came to, you either have titers or you get the vaccination as a part of your employment. And very quickly people quit worrying about hepatitis B. That's the credibility that we have to build. And then we get a new disease in the system, whether it's chikungunya or Zika or West Nile or whatever. And we built credibility. The second piece everybody had to hear was this vaccine was not built in 6 months. It's been built over the last 20 years on technology that's been very well proven. And so you build credibility with each of those things that we do as Fire EMS leaders. And by building a reputation, we'll protect our people and not mislead them. Tom, I think you're part of that, and I thank you for your role in doing it. And that's really important for us in everything that we try to address with our members.
Thanks, Doc. Dr. Gupta.
All right, sorry, I'm still getting used to unmuting myself. A couple of things. Number one, I wanted to comment the chiefs, and I thought it was really interesting that we all kind of came at this at a similar point of view. It's actually 30 years, Dr. Augustine. The first study was in 1990. But no, one thing I wanted to bring up, which I thought was relevant, is what I like to call the face of the enemy, if you will. Like, where are these additional people who are not getting the vaccine getting their information? This, to understand the studies, requires a high level of scientific knowledge that we realistically should not be expecting out of the layperson to understand. And even though firefighters have a decent understanding of science, you're asking about things that we studied over and over again in residency. And even then, some residents have a poor grasp of. And the reason I'm bringing that up is because there are a number of YouTube videos of doctors giving out false information, And they make it sound so good. You got to listen to these videos. They make it sound so good that if I didn't know what I was talking about, I would also think vaccines were bad. And so we do specifically attack them, but these videos come out every single day. And as Dr. Augustine will tell you, you may know, you can pay a doctor to tell you anything. So that's one thing I did want to bring up as a valid concern that we face on a daily basis.
No, you're right. And I wrote both of your comments down, that it's really, it seems like some of the science here is one part to build credibility, right? The leaders of the organizations have to be credible within their audience, the women and men of the fire department. And then you also have to find credible resources that can understand the science there, that, yeah, you have to build that trust. Those are excellent points. Yeah, other concerns. Yeah, Chief Dern.
The one thing I was going to add is we covered, a lot of our people did have a concern about being able to carry on with the job and what the effects down the road may be for them personally, but they had a huge concern about taking COVID home to their families. And I know initially when we started getting the vaccine rolled out here locally, the data was not really clear or unknown at that time, and a lot of our members were getting the vaccine just for that, just the hope that they wouldn't carry COVID back home to their wives and kids. And now the doctors could correct me on this, but we're starting to see a little more data that is helping, and I think some of our stragglers are going to start reading through that data and seeing that information and probably getting the vaccine as well.
Captain Ellis, do you have any observations? I know you clearly have an important role in the collaboration and getting max vaccines there in your area, but any perspective you might offer on this topic of the concerns out there from the troops?
Yeah, it's been a pretty interesting process, especially being involved more at the county level where I'm dealing with all of the first responder agencies. I think almost entirely, I shouldn't say entirely, but a huge majority of it was just peer pressure one way or another, right? On multiple times, multiple agencies, we had people that turned it down one day, literally overnight, changed their mind because they saw their buddies get the vaccine and they came to work and they were just fine. And so you had initially a lot of just rumors and hearsay and the what ifs, the unknowns, that kind of kept people away. But literally within days, when they saw their coworkers get it and be just fine, then they started jumping on board. So yeah, I think just that misinformation initially, but once they saw what was happening, or really the lack of what was happening, they bought into it. So,
do you think, Captain Ellis, that as we talked earlier about credible sources of information, credibility within the leadership that might be encouraging people to take the vaccine, is that kind of the silver bullet here?
I think so, and like what Chief Peterson said, I mean, a huge influence for us was just the information, the open and honest information, and not only from our perspective, but our medical controls perspective, from the IEFF perspective, including all that documentation and support, and then providing stories of those folks who had to deal with COVID, I think was huge. And it kind of got to the point where the risk of not getting the vaccine was worse than the risk of getting the vaccine. And that changed a lot of minds. So funny enough, law enforcement was much more skeptical than the fire department. So I don't have the final numbers, but I know initially there was a lot of phone calls from police chiefs that were concerned because 10, 15, 20% of their folks were able to, or were willing to get it and the rest weren't. So I'm not sure what causes that between the different public safety agencies, but it was pretty interesting to see.
I wonder if that's a sentiment that's shared. I know that locally I felt anecdotally that law enforcement was not as interested in the vaccine as we were. Is that something that the other agencies in Colorado and Utah, have you all seen that as well? That's interesting. Do you have any insight to that, Dr. Gupta? Still on mute, my friend. We'll get it figured out.
While he finds his unmute button.
I'm going to get it at the end, but before this is all over. For the law enforcement, I apologize. For
While he finds his unmute button, let me try to answer.
Yeah, got it. Okay. No, if you can field the law enforcement question better, that'd be great. I just wanted to I'll give a quick update for the sake of people on this chat regarding the current COVID vaccine data. We found that the initial projections are holding out over the 50 million that have been vaccinated so far in terms of efficacy. And in terms of duration, we were worried how long it would last. As far as we can tell, it's at least 6 months, maybe up to 8. And we still are seeing if it'll last even longer than that. If Dr. Alex can speak more about the law enforcement question, though.
You know, the law enforcement, let me just say the police officers don't have the benefit of dealing every day with healthcare information and with medical directors and chiefs who are very astute on infection control and other issues. And every place that I have a chance to interface with the police department and to set policies consistent between fire and police and corrections and other departments of the city or county as needed. We have a great opportunity. We interact all the time. We deal with these issues. Otherwise, misinformation can quickly be disseminated amongst people who don't have as ready an access. And so I consider part of my responsibility, although I'm no longer a police medical director. I did only that role when I was in Washington, D.C. But our police officers deserve the same protection and the same information. And I think we benefit ourselves in the fire service when we disseminate it with our public safety brother.
I kind of wondered after Captain Ellis's observation, and I haven't thought about that, but that Pied Piper syndrome, that peer pressure for the good or the bad, I almost wonder if that had an impact in law enforcement, that they didn't have the fire station has the kitchen table to go back and discuss it and sometimes get more comfortable with the idea. And maybe that worked to our benefit versus law enforcement being, that's for the vast majority of the country, it's a lot of independent cops out there making decisions. I don't know, that's the very interesting perspective. So, this is going to be a webinar that is viewed, by a lot of people, arguably people who may want to improve things within their organization. What I'd like to do to kind of start wrapping up today's conversation is maybe ask all of you to think back over what you've experienced over the last year and how you implemented this vaccine rollout, and maybe consider what one or two pieces of advice would be to organizations that are still in the middle of this and maybe for the pandemic to follow or the crisis to follow. What is the lesson learned there? So Chief Lombardi, I know that you had an earlier exit than some other folks. So if it's okay with you, Chief, I'll start with you.
Well, I think just, we've hit on it. I think our best resource that we can do is provide factual information and build that trust that we've done with there. I can't think of anything different. As we've gone through, we've done a lot of things, but when you look at best practices, and I've had a chance to talk to fire chiefs across the nation on this as well, on the same subject, that it ends up being having those relationships already developed. And if not, then make sure you're building those bridges, but it's communication, it's honesty, transparency, all of those things. And so I think that's really the success of it. So from West Metro's perspective, what we've done, and we've made a huge point of this, maybe even to the point of over saturation on information, but we figured if we did that, then they didn't have the gaps to fill in if there was less information. So we've done that, and again, I think we've been successful with that. But again, in talking with other successful organizations, especially with vaccines, they've done a lot of the same types of things.
Chief Peterson, how about your organization? Any tips or advice looking back?
So I think I got a couple of things, and first I'm gonna build a little on what Dr. Gupta talked about, and that's the issue of, I think we have a tendency to want to solve our own problems, and there are a lot of professionals that you need to reach out to. For us, we run the county EOC, and we had the health department in our building. We had an extra 40 people for 8 months in our administration building as part of our EOC. And it gave our team a chance to work directly with the medical staff from the health department and our medical director. And I think it gave us an edge in good quality information as opposed to trying to read the studies ourselves. We're firefighters. We are not the medical professional. We may be paramedics, but we didn't study residency on communicable diseases in the same way. And I absolutely please work with your professionals and get away from the news that might be just posted on Facebook and get to the things that you really need to know. And I think the other one is a comment that Dr. Augustine shared, and that's related to the initial reactions that were published nationally. I mean, we did a lot of work to try and get us at the front of the line as a priority service provider. And we were in a very good position with the CDC to become one of the early ones provided. And then all of a sudden, everything changed, and we ended up scrambling to see if we could get in front of the people that cleaned the bathrooms at the school, realistically. And if it wasn't for our relationship with our health department, we wouldn't have been in a good space. But I think he's absolutely right in that it was the stories that were broadcast that the firefighters weren't going to get this vaccine that moved us out of the line, right? Tom, you might have a better idea of that background. Maybe Jim does too, but be careful what we start talking about and what we communicate when we don't have the facts. Tell the truth, tell the honest truth, get with the professionals, and then communicate openly like we've already talked about. But aside from what's already going to be talked about, I'd give those 2 items. And we have a responsibility not to go off and talk about the fact that we're not going to do this. As do our labor unions have a responsibility to communicate effectively when it comes to the realities of this and work with the professionals in these areas.
Those are great comments, Chief. Chief Dern is the Chief of Operations for large metro organizations. Do you have anything to add there?
I would just add, I think from the onset of the pandemic, Chief Peterson pulling in a team and standing up a management team to manage this for our organization, from everything to new operating procedures, to safety, to PPE, to health, to everything that affected our employees. It just put us on the right foot from the get-go to be successful and force the communication like a lot of the other chiefs have mentioned. And I think that was huge in our ability to manage it the way we did.
Awesome. I appreciate that. Now in LA County, Dr. Gupta, any advice from you and your colleagues in terms of what could be replicated in other organizations to help with the rollout?
Absolutely. Once again, I want to commend everyone on this call. It's amazing how we all did the same thing and approached it similarly. I wanted to make a comment for any medical directors or wannabe medical directors that may be on this call, in that the firefighter culture is so unique that we actually really integrated as many the firefighters into our fold so that we could disseminate the message in a way that I guess they felt more comfortable with, they could understand more, and they felt that level of trust with what we were saying. And like everyone did here, we try to create one message, keep it straight to the data, be completely transparent. So we had the highest level of trust that we could have in our message. And by doing that, and by creating a safe environment for people to come out and be ill, we were able to mitigate the damage to our department itself, as well as hopefully increase the vaccination. Thank you.
That's great. Steve, did you have any observations to tag along with Chief Lombardi on those lessons learned?
Sure, Tom. Actually, for us, I don't think it was one or two things. What I think was really important for us was that that ideology of inclusiveness that we're all striving for within our organizations, and not making sure nobody was outside that circle, and not being afraid to talk to and have those challenging conversations with the folks that maybe didn't believe the exact thing that I believed, that I read. And I think for us, that was a really important part of the success or where we're at, is making sure that, yes, we listen to everybody, we understand your concerns, but we're going to continue down that path of science and facts, and just make sure that all those little micro communities that we all have in our organizations are listened to, and then following through with that and making sure that we follow up and pay attention to that going forward. So I don't really think it was one or two things. It was making sure that we were paying attention to everything, if that makes sense.
Absolutely, and I'm sure you're right. Now, we do have a question from one of the attendees today, so I'm going to read this and just let it be a free-for-all for anybody who's got the best answer. It asks, any advice for agencies that did not have employees who experienced significant COVID events? Our personnel did an amazing job with personal protective equipment and other protocols, which we believe contributed to our infection rates. Thankfully, we didn't and still don't have employees who became very ill. So without, I think, Dr. Gupta, you put something in the comments as well about, statistics don't always tell the whole story. You need these elements of humanity, a good story sometimes to get people's attention. What for departments that didn't have significant COVID impact, which I would take to mean healthcare impact to their employees, what advice do you have for them? Dr. Augustine?
I'll wait for Dr. Gupta.
Okay, sorry. I just saw you off mute. There you go.
Like I said, the stories are so important. That's something in human nature. Time and time, if you look at books like Thinking Fast and Thinking Slow, how to influence people, how typical lobbyists affect politicians, like statistics are dead. You can say X amount of numbers, but they really want to hear about the people. And I'm so happy for you that it didn't affect your department, because honestly, I don't want COVID. Once I saw it, I did not want it at all. One number that may be able to help you, and this is, we publicly put out our data, so this is not me, this is allowed. I can tell you in our department, at least when I did a review of our stuff, and I did look it up, 39.1% of the individuals who caught COVID had prolonged exercise intolerance to the point that they were unable to be firefighters. So what I did when I was around really big fires, because if someone has COVID in an apparatus, they're usually going to take everyone else in the apparatus out, was I was like, think about if you're sick in an apparatus and everyone gets ill, at least one person in that apparatus is not going to be able to return to work for several weeks. And that kind of really made it real for them. Hopefully that helps.
I congratulate any department that had low incidence and thank them for doing good procedures. Unfortunately, the majority of infections in my departments came from home exposures. And we sometimes have a problem with that. The IAFF has really been a big supporter of great practices and talking about the big four: masks in appropriate places, wash your hands, don't come to work sick, which is really an important message. So early on, the IAFF was supporting the really good practices. They've also been tallying the numbers of people that have died and people who have been incapacitated. Dr. Gupta is exactly right. We have a lot of people who require fitness for duty evaluation to try to come back, because there have been such significant hits to the people's cardiovascular systems in particular, and can't get back to work. So we have stories that come from the union. We have stories that come from our National Fallen Firefighters, et cetera, that are easy to kind of fill in the blanks in terms of the impact. And linking this to vaccines, the story out over the last couple of days is that people with long hauler symptoms are getting improvement with a vaccination. And that should again move people towards, there's a lot of good reasons to get the vaccination. And for those that have had long haulers kind of symptoms, they're having advantages as well. Thanks, Chief.
Thank you, Doc. Appreciate both of you. So today we've been having a conversation with colleagues from all across the country, physicians and fire chiefs and everybody in between. Represented today was the fire chief and division chief with West Metro. We had the Unified Fire Authority, the assistant medical director for LA County Fire, and of course, Dr. Augustine with the IAFC's COVID-19 task force. I appreciate all of you gentlemen and you ladies for helping facilitate this and have a conversation. Most importantly, I think there's a lot of reoccurring themes, the theme of collaboration, working with the local, building credibility and trust, and making sure that along with data and important information about statistics, that we have stories that can compel people to hopefully do the right thing. Thank you all for being here today, and thank you to NDRI for sponsoring this particular podcast.